Let's turn to health matters now, where health reform advocates are urging the federal government to use at least 500 billion naira from the funds set aside for providing palliatives to cushion the effect of the subsidy removal for citizens. They want this done to provide adequate health insurance coverage for at least an additional 30 million vulnerable Nigerians for the next 1 year. Health correspondent Kemi Balogun reports.
Nigeria's health sector continues to be plagued by various challenges, including the incessant strikes by doctors and other health workers, further limiting the efforts to reform and revitalize the sector. Between 2013 and 2021, the incessant strikes by resident doctors and other health workers working in federal government-run hospitals gulped 61% of the chunk of strikes recorded, resulting in the loss of about 300 working days. These strikes have also been mainly in addition to the worrisome trend of brain drain. This health sector reform coalition wants more things to be put in place to ensure that the country provides adequate health care to Nigerians by reducing the challenges plaguing the sector.
Every doctor, the priority is go out of the country. Even consultants who are senior personnel, it shouldn't be so. So this is negatively impacting on our health sector.
In a bid to provide more health security for citizens as well as to achieve universal health coverage, better healthcare financing and reforms will be needed to get to the goal.
Given the rate of 15,000 naira per person per year, that's the insurance, the sum of 450 billion naira will cover for the health insurance of 30 million vulnerable Nigerians. This additional 30 million lives will increase the insurance coverage of about 18 million or 8.5% of the population, according to the current figures from the NHIA, to 48 million.
We have more money beyond that 500 billion, which could still be used as palliatives, focused on the removal of fuel subsidy.
There are many best practices in Nigeria which have been tested over time. We simply are not sustaining these best practices, so we need to revisit them.
The coalition is also seeking better legislation through the inclusion of universal health coverage in constituency projects and a revision of the National Health Act of 2014 by increasing to 2% the funding for the Basic Healthcare Provision Fund. Kemi Balogun, TVC News, Abuja.
Where, as the Senate was busy with the ministerial list transmitted to the Red Chamber by the executive, the Speaker of the Nigeria's House of Representatives was also inaugurating about 134 standing committees for the oversight function of the Parliament. Tajuddin Abbas charged the committees to prioritize national interest far and above members' personal desire. A National Assembly correspondent, Joke Adisa, reports.
45 days in the life of the 10th House of Representatives, it now has the full complement of 134 standing committees. In his speech just before unveiling the leadership of the committees, Tajuddin Abbas calls on his colleagues to promote peace, order, and national interest as they settle down to work.
Even as we embark on the oversight of other arms of government, we must see the powers of oversight given to us by the Constitution as a means to promote good governance through compliance to the laws of the land.
He says given the high turnover of new legislators, there is need to build the capacity of newly appointed committee chairmen and their deputies.
Separation of powers does not mean separation of government. We are one and the same government with the sole purpose of providing services to the good people of this nation. We remain committed to a harmonious working relationship with the executive in order to deliver on the mandate of the people. However, we will not fail to bring full legislative powers to bear on recalcitrant NDAs.
Then comes the moment members have been waiting for.
Appropriation Committee, we have Honorable Abubakar Bichi as the chairman, Honorable Idu Igarwe PDP Ebonyi as his deputy. Constitutional Review, Honorable Benjamin Kalu.
Former Deputy Speaker Hamid was chairs the Committee on Federal Character. Former House Leader Halazana Dodogwa is now chair Committee on Petroleum Upstream. Former Deputy Leader Peter Akpatasin now chairs Aviation Committee, while former Appropriation Committee Chairman Aliyu Betara oversees the Federal Capital Territory. Among those who retain their chairmanship seats Babajimi Benson as Chairman House Committee on Defense, James Faleke as Finance Chairman, Lecky Abejide of Customs, Yusuf Gagdi of Navy, Tanko Sununu of Health Services, and Sada Soli of Water Resources. Osun lawmaker Bamidele Salam now chairs the Public Accounts Committee, and Kafilat Ogbara from Lagos is chair House Committee on Women Affairs. After the end of his first session, the Speaker announces a 6-week recess, but says other committees may choose to continue their assignments in the course of the holiday. Joke Edsa, TVC News, Abuja.